is Susier Lupe. I'm the clinic manager for Occupy Medical. We have been serving the public as a free, patient-driven healthcare service for over a year. Our doctors right now have a challenge because they cannot proceed with the complicated diagnosis that they have until they get good lab results. Lab testing, it's very expensive. It is money that we do not have. Every penny that we get in goes to the patients, but we need $2,500, and there is a lab in town that will match those funds and will be able to help far more complicated patients. We started Occupy Medical just as a first aid tent at Occupy, and our intention was simply to help people with whatever first aid needs they needed at the camp. And when the police closed down the camp after a few months, we watched our patients go away, and we realized that the patients that we had were not going to get care anywhere else in this community.
When they got their big bus, I was lucky enough to be here the first day it drove up, and the doctors there really listen to you. They don't just try to throw you a pain pill and say, gee, see you in the ER a couple more days. They're really attentive, like doctors should be, and I'm not finding that in the general supply of doctors.
They're very genuine about what they're doing. I mean, they're not trying to fake it. They're not trying to push you through like cattle. It's very obvious that they care, and their heart's in the right place.
Whatever it is, they keep it to themselves, and they're really helpful. They're really nice people.
The people here that do this service are so polite and so helpful and, encouraging that you walk away from here not only getting good care, but you walk away with dignity. And I think that's critical. I really do.
Everybody should have health care anyway. I mean, all the money the government spends, we're going to Mars, for Christ's sakes. Why can't we have medical?
We did have a patient recently that had intestinal worms, and that is a very serious disease, but it's very easy to treat. We can't treat it without a lab, however, unless you get it confirmed as that intestinal worms is the diagnosis. You can't even begin treatment. If we can get lab tests for people, we can offer even more complex help for more complex patients. The doctors right now are just missing the lab results, and then there's so many different kinds of people that we can help.
It should be everybody help everybody out. It's really important. It's about people, not about money.